Hi, everyone. This is Dr. Ruth the Pain Doc, founder of Chronic Pain Rescue. Thank you so much for joining us. If anyone is in the chat right now, feel free to, if you have any questions. We have a guest today, Dr. Sarah Pospos. I'm going to let her introduce herself. What we're going to be talking about, I think, is really great, but let her go ahead and speak. Thank you, Dr. Pospos.
Thank you so much, Dr. Ruth, for having me today. I really appreciate it. Hi, everyone. My name is Dr. Pospos. I'm a perinatal psychiatrist and mom of two under two, as well as sports psychiatrist and former student athlete based here in California. I have my own private practice at lifestyletelePsychiatry.com. And yeah, just excited to be here. Thank you so much once again, Dr. Ruth.
Oh, great, great. Now, so I didn't realize the perinatal and the sports. That's different. That's different. Not the topic that I asked you for, but those are interesting topics. I'm sure for women that have postpartum depression, stuff like that. Is that what you help? One of the things you help? Yeah,
Yes, definitely.
yeah. And then for sports, that would be like helping them get in their game head kind of thing. I'm not sure.
Yeah, definitely. Because as you mentioned with athletes, they have these unique challenges, right? That could definitely be helped by optimizing their mental health as well. And I'm so glad you asked as well because of those two different fields, perhaps. In my practice, in my psychiatry practice, I would also love to incorporate all these lifestyle techniques, right, including exercise, nutrition, sleep optimization, stress management, effective stress management as well, in addition to the traditional psychiatric model, just to make sure that we get that optimization in terms of life quality too.
That's great. That's great. I'm appreciative of that. I think people recognizing that traditional medicine doesn't really cover everything that people need, and especially I think with psychiatric and mental health issues. And that's kind of what we're talking about today. And when we talk about stress, a lot of people that are out there that are suffering from anxiety,
Hmm.
suffering from panic attacks or even PTSD. Um, you know, there maybe I could ask if we dealt with panic attacks first. What is a
Hmm.
panic attack? Because I think it's important to understand what the definition and what the symptoms are. Maybe people are having it and don't even recognize that that's what they're suffering from. What is a panic attack?
Yes, 100%. And like you said, maybe people are having it, not recognizing what it is, and it just adds additional layer of stress, right? Of not knowing what is it and not knowing how to label it when it occur. So panic attacks, essentially panic attacks is an event or an episode when you feel so anxious, you feel so fearful to the point that you started having some physical symptoms associated with it. So the physical symptoms could look different for everyone. For example, some common ones include feeling of choking, the sensation that you might be choking, feeling of palpitation, your heart started to race, having shortness of breath, or perhaps some chest pain associated with it, tingling in your bodies, in your fingers, in your toes, or feeling heat, feeling hot all over your bodies, your face. It may also look like this sudden fear of losing control, that you are going crazy. A lot of people mention that, or that you might feel like this sudden fear, very significant fear that you are dying at the moment as well. A combination of those symptoms could occur within panic attacks. It typically lasts, a couple of minutes, and although sometimes you could pinpoint the triggers, a lot of times it might also come out of the blue, out of nowhere,
Okay.
suddenly as well.
Okay. Have you ever heard, just to, I guess, to ask, have you ever heard of anybody doing things like with their mouth? Maybe they end up bleeding because somehow they're like biting their gums or something like that. I don't know if that's also something that's possible with a panic attack, or is that something else?
Good question. I haven't.
Okay.
Although, having said that, the experience in terms of the physical sensation, physical experience that are experienced by those in panic attacks might differ. So it's
Okay.
possible, but so far I haven't encountered that yet.
Okay. And just one other question, because
Yeah.
somebody was describing that they had panic attacks, but it didn't sound like what I've heard. Can somebody having a panic attack get in kind of a rage, like, they're potentially violent, or threatening violence? Would that be something else, or because they called it a panic attack? I don't know, but I'm just asking.
Yeah, great question. So it's not definitely not common, not the more common symptoms of panic attack that usually is
Okay.
described. Uh, and so it may be a panic attack, it may be something else. In that case, if we just know that they're having a rage at that particular moment, so I would
Mhm.
say it probably it would need more
More
exploration in terms of what's going on at that time as well.
Sure, sure. Now, if you have someone that comes to you with either anxiety or, they can't really function, or it interrupts their life, how would you approach that for someone coming to you with anxiety?
Yes, I'm so glad you brought it up. In fact, anxiety, right? It's a word that got thrown a lot. A lot of people mention, "Hey, I'm anxious, I'm stressed, I'm worried." It's sometimes it could become interchangeable.
Mhm.
So when for those that come with anxiety, perhaps one of the first things to determine is the level of how it interrupts their life. So, some quote unquote red flags may include one, if the anxiety symptoms is so severe to the point that it's very, very distressing to them.
Mhm.
Or two, if the anxiety symptoms start to interfere in any way with their day to day functions. So, for example, if they're a student, it starts interfering with their grades, if they're working with their work, perhaps with relationships, family, loved ones, and so forth. And if either one of these conditions are met, then most probably the anxiety could be categorized as a quote unquote disorder at that point, or an impairment.
Okay, okay. All right, good. And what would you suggest that they do, or how would you, manage them with that a symptomatic anxiety that's, interfering with their work, or with them, at home trying to take care of kids or whatever. What would you recommend for them?
Yes, absolutely. So, first off, it's probably look different for everyone, right? It's a case by case analysis, just
Right.
as everything in medicine. So, in general, though, as a general principle, typically some factors that we can consider include, for example, the severity of symptoms. Is the symptoms on the milder side, moderate versus severe? If it's on the milder side, then typically we could offer a couple of options, including whether they are more comfortable with just therapy, talk therapy,
Mhm.
or if they prefer medication, we can offer that too if indicated, or a combination of both. Um, so it's a lot of the algorithm or the decision making process would be collaboration between what we see as a psychiatrist as well as what the patient is experiencing or prefers to some
Right.
extent as well.
Right. Okay. Okay. Very good. What if somebody's they're having racing thoughts, they're not able to sleep because of all the things going on, and they can't stop thinking about it. But they're tired, but they can't sleep. What do you suggest for them?
Yes, so if the it's also pretty common racing thoughts and in this case sounds like in terms of racing anxiety thoughts, right? Just the different worries, different threats that constantly are playing in the back of their mind, perhaps to the point that it interrupts their sleep. It is common, and it could be symptoms of an anxiety related condition. And if that's the case, if we determine that it's part of the anxiety symptoms as a whole, the best approach would be to treat and to optimize treatment for that anxiety. Uh,
Mhm.
because that way, as we optimizing that treatment for anxiety, this symptoms, this
Mhm.
interruption to sleep would also get better along with the other anxiety symptoms in general.
Okay. Are there some concerns or, you know, how do you know if maybe you put them on a medication,
Mhm.
and how do you know if they're having a bad, like that medication isn't, it's having some complications or some side effects, or what should somebody who's on a medication for anxiety
Mhm.
just watch out for to make sure it's working, but you know then that's my problem with traditional medicines, is that so many of them have some other thing. You're taking it for one thing and you get something else that you have to be worried about. So just wondering, in terms of anxiety meds, what should people know, be aware of.
Yes. So it would depend on the specific medication, right? But I think the best approach in terms of principle in general is to try to minimize polypharmacy. So I'm glad you brought that issue up. Meaning, we just use we use medication only if indicated, and two, we try the lowest effective dose instead of over quote unquote over medicating them that way. And three,
Mhm.
we eliminate unnecessary combinations. Of course, if necessary, then it's a different story. But as much as possible, we try to minimize polypharmacy in that way. And in
Okay.
terms of side effects to watch for, what I like to do in terms of my practice is before starting anything, I would like to go over details in terms of what this medication is for, what would be the pros, the cons for this medication, what would be the alternative, the pros and cons of that alternative versus not giving medication, for example, what would be the pros and cons of that. That way, I believe, the patient would get more understanding of what's going
Mhm.
on, know what
Mhm.
to watch out for, and perhaps more importantly, make an informed decision before they enter to a decision to take a certain medications. And of course,
Okay.
having said that, in our follow up, we always not only check if medication is helpful or not, but also any side effects, whether the ones that we talked about before or some new ones that the patient might be experiencing. It's always good to monitor that as well.
Okay. So you make me think about, because we're in California. What do you um, believe or feel, or if somebody says, medical marijuana, they're asking you for that. It helps them to relax, um, and helps their anxiety. Is that something that you recommend? You don't recommend? You whatever? I'm just asking.
Yes, great question. So I don't recommend it. In fact, I would recommend to avoid it in terms of anxiety, within the context of our talk, because it could increase anxiety, just like it could increase, feeling of depressed mood, um, in those who are already anxious or are already depressed on baseline. In fact, even for those who are not anxious, not depressed on baseline, it could introduce this feeling, this higher anxiety level, higher depressed mood. So, as part of my recommendation, I recommend to avoid marijuana or cannabis for that
Okay,
reason.
interesting, interesting. Okay, we're similar similar thoughts on that. People, I get very upset about the general Wall Street. I just put it like that. Wall Street promotes whatever's making money, and they don't want to deal with whether there's negative consequences, even if it's just a portion of society. Obviously maybe there'd be 100 people that can use it and there's no problems, but then there's about three maybe that they need to be aware that this might cause them to get psychotic. It's possible. And the fact that the
Definitely.
general, you know, whatever is not showing that, or even the fact that, young people, while their brains are still developing, shouldn't be using it. It can affect
Hmm.
how their neurologic system develops. And
Hmm.
it just bugs me that it's not being said. I'm like, ugh. Not enough. Anyway, put it that way. Not enough. Not as much as, oh, it's okay. So thank you for that. What about the people that, now this is kind of an obvious, but what about the people that find that, alcohol helps them relax, and they have a few drinks every night. That's what's relaxing them. I know it's probably obvious, but just to put it out there, what would you say?
Yes, so glad you brought it up because it's very common as well, right? So I have same recommendations along the same lines in that specifically alcohol also could increase anxiety level, could increase feeling of depressed mood, could interrupt with sleep as well, which of course would affect our mood, our anxiety level, just our mental state in a lot of ways. Um, Especially in those who are already anxious or are already depressed, and even in those again who are not anxious, not depressed on baseline, alcohol could introduce this effects. Therefore I would avoid to I would recommend to avoid it as well.
Okay, awesome, awesome. Wow, is there anything if you had to give someone, oh, we didn't even talk about PTSD. Hold on, before I finish. I mean, there are a lot of people suffering from trauma, whether it's
Mhm.
psychological trauma, physical trauma, and they have PTSD. What, again, just for the audience, so people can understand, maybe they didn't recognize they had PTSD, and as they think about it, as you explain what it is, they kind of,
Mhm.
recognize, oh, that is my problem. What is PTSD?
Yes, so PTSD, post-traumatic stress disorder. PTSD is a common psychiatric condition. So basically, what it looks like is it could look like a lot of things, but first thing to note is there needs to be a history of trauma, right? But I think, and interestingly, it doesn't need to be direct trauma. And what I mean by that is, uh, for this piece of having a history of trauma, one could experience the trauma directly, or they could perhaps witness it directly, or they could learn about traumatic event that happened to family member, close friends, or even they could get exposed, so get some exposure, constant exposure to a
Hmm.
perceived detail of certain trauma over and over again. So there's a lot of ways, so to speak, to have this history of trauma, not just direct exposure yourself to trauma. In terms of symptoms, it could look like a lot of things, but more common symptoms include intrusive symptoms. So that could look like recurrent nightmares, recurrent flashbacks, recurrent intrusive memories about what happened over and over again. It could look like avoiding constantly or going out of your way to avoid triggers, reminders that remind you of this trauma. It could look like, having hyper alertness, so being more hyper vigilant, getting startled easily, things like that. It could also very much affect our mood and our cognition. So those experiencing PTSD could look like they're more depressed, more isolated, not enjoying things that they used to like anymore. They might find themselves with some difficulties in concentrating and sleeping, and just having constant state of negative emotional state in relation to those trauma as well.
Hmm. And what about if they could maybe, if they're very irritable, snapping and things like that? That's that part of PTSD as well.
Could be definitely. So it could affect their mood in that sense as well. Being more irritable in addition to being depressed, being down, viewing their self, having more negative self-image, viewing their self more negatively. So yes, irritability
Okay.
could be part of that mood symptoms as well.
Now, how long after, say, they've had a traumatic experience, how long after that should they seek help? Because, people kind of think, oh, with time you'll get better. Should that be something that's like automatic? The next week they start seeing the psychiatrist because they're having nightmares, or is that something they should wait? And I'm just asking, what approach should somebody have? They know they had a really traumatic experience. They're having bad dreams. They're recalling it all the time. When should they come see someone like you?
Yes, I would say if for the audience out there, if you're doubting, meaning that you have a doubt in the back of your mind, is this normal? Is this not? And you're bothered by this doubt, right? This constant doubt. I would say there's it's a good idea to get help, or at least to get evaluation, formal evaluation for that peace of mind. And in terms of a good red flags to keep an eye out for. I would return to those two red flags that we talked about in the beginning of the session, which would be if the symptoms creating severe distress, intense distress in yourself, or if these
Mhm.
symptoms you notice start to interfere or impact in any way your day-to-day function, then it's definitely a good idea to seek help or to get connected with professionals.
And I presume, I shouldn't presume, but similar to what you said before, that it depends, the approach would depend on the person, right?
Hmm.
Whether
Right.
you have medication, whether you have counseling, whether you have a combination. Um, yeah. Does there, does group therapy help with things like that, with PTSD, or that's something more, it's better one on one? Just
Yeah.
wondering.
Great question. So it depends, but and again, this is not medical advice, it's just for educational purposes. But some of the more researched therapy methods for
Mhm,
PTSD specifically would be along the lines of trauma focus, including CBT, cognitive behavioral therapy, as well as some sort of exposure therapy that has exposure component as well. So having said that, one-on-one is definitely beneficial, but again, it depends in terms of whether group on top of that one-on-one could be more helpful for that specific individual or not.
okay, and do you offer CBT? Is that part of your toolkit?
Yes, so I don't offer official CBT session. I don't offer official therapy session, so to speak. But I do utilize therapy principles, including CBT principles during our medication evaluation or medication management session in my practice.
Okay, all right, very good, very good. Gee, you had asked me a question that I wish I had a good question like that. But anyway, what would you like? I think we've answered. I haven't seen any comments in the chat, but that's okay. What would you tell somebody that's been suffering for a while from anxiety? Um, to just kind of a parting word for them so they can maybe feel encouraged. Um, what would you say to them?
Yes, I would say it could be very, very overwhelming to deal, right, with anxiety constantly, having that sensation of waiting for the other shoe to drop in the back of your head day in and day out, to the point that perhaps it's very hard to sleep, like you mentioned earlier, Doc. It could be really hard to concentrate, to make a decision, just to perform at work, at school, and it could feel very, very overwhelming, but it doesn't have to be that way. Help is just one phone call, one click, one email away. So if you are noticing, or if someone pointed out to you that you might, experience these symptoms to the extent that it caused distress in yourself, or to the extent that other people are starting to notice, then it's a very good idea to get help, to get connected. If you're in California, and you don't have a local psychiatrist yet, you can reach out to me at lifestyletelePsychiatry.com. I'm also on Instagram with the same handle, Lifestyle Telepsychiatry, and I serve California patients via telemedicine as well.
Awesome, awesome, awesome. And do you take insurance? I'm just asking.
I don't at Lifestyle Telepsychiatry.
I see. Okay. All right. Well, it's good for people to know that, and they can just go to your website and they can reach out to you. All
Definitely.
right. All right. Very good. Thank you so much, Dr. Pospos. This has been very informative. I really appreciate it. Thank you.
Of course. Thank you so much, Dr. Ruth, for having me. And thank you so much, everyone, for your time as well.
Okay. All right. So, bye, everyone. Peace and blessings.
Bye.